Welcome to Spotted, the Speech and Occupational Intensive Treatment Program. Spotted is an early intervention, interprofessional program that offers intensive treatment in increments of 3 to 6 weeks. It is an evidence-based, child-led, parent-mediated program. Research has shown that dosage matters, and children who participated in the Spotted program have demonstrated significant gains in their speech, language, social, sensory, fine, and gross motor skills, as well as in their overall functional developmental levels. We are excited to embark upon this unique journey with you and your child. Next, we will answer some commonly asked questions about the Spotted program. What should I bring to the intensive? Your child will be here for 3 hours, so please pack diapers if needed, a change of clothes in case we get messy, a drink, and a snack. Do I need to stay for the intensive? We recommend that the parents or caregivers participate in the intensive for at least the first week. We will be using this time to help you learn the methods and principles of the play project and sensory integration so that you can continue to implement these types of therapies with your child. How should we dress? Wear comfortable clothing because we will be sitting on the floor playing with your child. Also, we are a shoe-free facility, so plan to remove your shoes upon entering. If it makes you more comfortable to wear socks, bring them. The ones with grips on the bottom are definitely the safer choice for you and your child. Can we bring food or drinks? Yes, food is allowed in the office, but we recommend eating before coming. If you bring any food that needs to stay cold, we also have a mini refrigerator that you are welcome to use while you are here. We also provide water and coffee if you need an extra energy boost. We ask that you keep all food and beverages out of the gym area. Why do you take videos? Video modeling is a great way to learn and practice new skills. When we video our play, we can look at it later with a clear mind so that we can notice things we did well and things we can improve. They also serve as a great baseline of the skills that are evident at the beginning of the program to compare to the skills at the end of the program. When will I start to see results? Every child is different and progresses at their own pace. They are growing skills, and that takes time. Depending on the child, we will start to notice subtle changes early on, and will point these out throughout the sessions. The most noticeable changes will be discussed when we compare the pre- and post-data results. Will my child learn to talk during this program? We will be working on all the foundational skills that are necessary for speech and language. We focus on communication, which includes gestural as well as spoken language. Since this is an individualized approach, we will explain where your child is in his or her development and what we are doing to promote functional communication through the use of combined speech and occupational treatment methods. What is the difference between speech, language, play, and occupational therapy? The focus of each intervention is similar in the lower levels of development, but are approached through a different lens. As your child climbs the developmental ladder, speech, language, and play will focus more on communication, while occupational therapy focuses more on sensory and motor development. So, what's next? After the intensive time frame is completed, your therapist will review your child's progress and make specific recommendations as next steps. These recommendations may include repeating the Spotted program for another round, continuing in treatment for the traditional standard of care dosage 2 to 3 times per week, or discharging from the program altogether. Regardless of the recommendations, your team will collaborate with you to create the best next steps for your family.